the entire A team, because we are the Sweet 16, for the hard work in preparing for this hearing. Now I'd like to turn it over to my co-chair, Councilmember Lewis, for her opening statements.
Thank you, Chair Stevens, and good afternoon, everyone. I'm Councilmember Farrah Lewis, Chair on the Committee of Women and Gender Equity. I'd like to begin by thanking my colleague, Chair Althea Stevens of the Committee on Children and Youth, for holding this important hearing. I would also like to welcome everyone who is joining us here this afternoon. We appreciate your time and participation. Under the best of circumstances, foster care poses many challenges for the children and youth who are participants within the system. We know that children in foster care enter the system with unique histories, including those of trauma and, in some cases, abuse. Add to that an overrepresentation of LGBTQ plus youth who are often thought of as the others. Within a system of others, if you will, we have a group of youngsters who are in need of care, understanding, compassion, education, and when necessary, behavioral health supports. In 2021, the ACS LGBTQAI plus action plan reported that LGBTQAI youth were overrepresented in foster care, representing over 1/3 of the foster care population, and were more often youth of color. LGBTQAI plus youth reported having experienced little to no control over their lives in foster care, and reported having heard staff refer to them as being hard to place. These youth reported feelings as they had very little support and were found to suffer from higher rates of depression and reported experiencing fewer feelings of optimism when compared to non-LGBTQIA youth in the foster care system. At this hearing, the committees look forward to hearing from the administration about the current policies and practices in place to address reported incidents of safety and discrimination faced by LGBTQ plus youth in the foster care system, particularly the plans contained within the agreement between ACS and the Ali Forney Center. The committees are also interested in hearing from the administration and members of the public and other interested stakeholders, including those who has lived experiences, who have taken the time to come here today to join us, and we thank you again. I would also like to thank my own staff as well as those of the committee, the joining committee who worked so hard to prepare this hearing. Finally, I'd like to thank Women and Gender Equity Committee staff, Legislative Counsel Sahar Mozami, Senior Legislative Policy Analyst Christy Dreyer, Vida Yagnik, the Finance Analyst, and Rosa Martinez, Assistant Deputy Director of Data Operations Unit. I will now pass it back to Chair Stevens. Thank you.
I forgot to gavel. It's been a morning, guys. Bear with me. I would like to recognize my colleagues who have joined us, Councilmember Riley, Councilmember Lee, Councilmember Joseph, and Councilmember Osei. I would like to turn it over to Councilmember Riley to say remarks about his bill.
Thank you, Chair Stevens, and thank you, Chair Lewis, for holding this much important hearing today. Good afternoon to everyone in here with us today. The Administration for Children's Services and Foster Care System play a critical role in safeguarding the well-being of vulnerable children who, due to various circumstances, cannot remain in their biological homes. The efficiency of this system is often hindered by a lack of comprehensive data collection and transparency. By gathering and analyzing foster care placement data, we can better understand the experiences of children in care to identify patterns, enhance child welfare, enable data-driven decisions, and ultimately improve outcomes. Comprehensive data on foster care placement notices will improve the systematic tracking of child's progress, needs, and outcomes, so we can create the stability that every child needs to thrive. With detailed records, social workers and policymakers can identify patterns such as the effectiveness of specific interventions or the prevalence of key issues like mental health concerns. This information can guide targeted support systems, services, ultimately leading to better health, educational, and social outcomes for our city's children in care. Increasing transparency in the foster care placement process can help foster families to feel more informed and involved, reducing the likelihood of placement disruptions, and increasing stability that is crucial for a child's development. Transparency in placement will not only help to protect vulnerable children, but also foster trust within the community and among stakeholders. Making strides for accountability in foster care placement is essential for fostering trust amongst stakeholders, including children, biological families, foster parents, and the wider community. Furthermore, this bill will hold agencies responsible to meet deadlines, ensuring that they adhere to best practices and prioritize the well-being of the children they serve. Steps taken to enhance oversight work towards a more effective and compassionate foster care system. Increasing foster care data collection and ensuring transparent and accountable placement is not just a bureaucratic necessity, but a moral imperative. Increasing data collection will also benefit biological families striving for striving to reconnect with their children. By maintaining comprehensive records, the system can provide biological parents with clear insights into where their child was placed in foster care and the timeline for reconnecting with their children. Detailed data on foster care placement can reveal gaps in the system, and such as areas with high foster care demands but insufficient foster homes. The well-being of the vulnerable children depend on our commitment to embracing data-driven decisions and transparent practices, so it is imperative that we take legislative action to support them. I urge you to support this important legislation and help pave the way for building a foster care system that is not only more efficient, but also more equitable and compassionate. Thank you, chairs, for allowing me to give my remarks today.
Thank you, Councilmember Riley. I would like to acknowledge Councilmember Caban, who's online, Councilmember William, and Councilmember Vernicroft. I would like to hand it over to Councilmember Osei, so let's open our remarks for his bill.
Thank you, Chair Stevens and Chair Lewis. And Chair Stevens, I hope you feel better. I know going through a committee hearing while feeling under the weather isn't the most fun. So I just wanted to share a couple remarks in regards to my bill, which is being heard today, Introduction 56. As many people may know in this room, it has long been known that LGBTQ youth are more likely to end up in our foster care system, where their needs are often not met. This is a compounding trauma, many times following years of abuse and neglect in and outside of the home. Government has a responsibility to care for these young people. We have a responsibility to be able to provide the best possible care as well, to adequately equip ourselves with the resources to tackle a problem. We need to understand its scope. Intro 56 will provide much needed transparency on LGBTQ youth entering and moving through the system. I encourage many of my colleagues who may not be on the bill to please sign on, and I would be remiss if I did not acknowledge all of the advocates and nonprofit organizations who have been pushing for legislation like this one, hearings like this one, and have really been sounding the alarm on this issue. Without you, we would not be making the progress that we are making today, and we would not be achieving some of the goals that we have set out to achieve in the future. Thank you.
At this time, I'll turn it over to committee counsel to administer the oath.
Hi, good afternoon. Please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions? Yes. Thank you. You may begin when ready.
Good afternoon. I'm Jess Danhauser, the Commissioner of the Administration for Children's Services. Thank you, Chair Stevens. Allow me to add my hopes for you feeling better soon. Chair Lewis and members of the Children and Youth Committee and the Women and Gender Equity Committee for holding today's hearing on this very important issue of addressing the needs of LGBTQ plus youth in the city's child welfare system. I'm pleased to be joined today by Elvita Dominique, who is the Executive Director of the ACS Office of Equity Strategies, Stephen Gordon, the Director of LGBTQAI plus equity strategies within the ACS Office of Equity Strategies, along with our colleagues from DYCD and the Unity Project and the Mayor's Office. It is of utmost importance to ACS that all youth and families who come into contact with ACS are treated in an affirming manner. We have taken important steps to continuously strengthen our efforts to do this, and I look forward to sharing this important work with you today. ACS is committed to providing high-quality services and improving outcomes for LGBTQAI+ youth in foster care. ACS has a dedicated LGBTQAI+ Equity Strategies Director, who I introduced earlier. Stephen is responsible for policy, best practices, and guidance for serving LGBTQAI+ children, youth, and families engaged with ACS across our entire sector. The LGBTQAI+ Equity Strategies team focuses on ensuring all ACS and provider agency staff treat all youth and families equitably and with empathy, regardless of sexual orientation or gender expression. In 2012, ACS was one of the first, if not the first, child welfare agency in the country to develop and implement a policy specifically aimed at promoting safe and respectful environments for LGBTQAI+ youth and their families. In 2013, ACS released a best practice guidance for serving transgender and nonconforming children and youth, which was updated in 2017. The policy and guidance laid out ACS's commitment to providing all youth and families served by ACS and our provider agencies with a safe, healthy, inclusive, affirming, and discrimination-free environment. Our policy requires LGBTQAI+ youth have access to gender-appropriate bedrooms, bathrooms, grooming, and hygiene products. Additionally, contracted foster care providers must recruit and support foster homes that are LGBTQAI+ affirming. Youth are also entitled to health care, including hormone replacement therapy and gender-affirming surgeries, which ACS will pay for if Medicaid will not. ACS also provides staff and contracted provider staff with LGBTQIA+ specific trainings. With the policy as a foundation, ACS and our providers have spent the past decade plus strengthening our practice, enhancing training opportunities, and providing technical assistance to our staff and provider agencies. All ACS and ACS provider agency direct service staff supervisors, and foster parents are required to participate in the ACS LGBTQIA+ training upon orientation and every 2 years thereafter. ACS remains committed to creating and nurturing a safe and affirming environment where all young people can thrive, no matter their sexual orientation or gender identity expression. ACS also contracts with 14 residential foster care programs that all provide affirming placements for LGBTQIA+ youth, including 5 group homes operated by SCO, which are specifically dedicated to LGBTQIA+ youth. All youth in foster care have access to individual counseling, educational support, health and wellness services, and a Fair Futures coach while they're in care and after. In 2021, after an initial survey and focus groups found that more than 1 out of 3 youth in foster care ages 13 to 20 identifies as lesbian, gay, bisexual, transgender, queer or questioning, agender or asexual or intersex, which is disproportionate to the general population. ACS released an action plan to strengthen our work specifically as it relates to youth in foster care. The action plan included a dedicated LGBTQIA+ committee as part of the larger ACS Youth Leadership Council, working with foster care providers on foster parent recruitment strategies and training, updating the 2012 policy, strengthening training for staff, adding SOGI questions to the annual survey of youth in foster care, and strengthening the services and supports for LGBTQIA+ youth in foster care. ACS has made a great deal of progress since the release of the action plan. In addition to the creation of the YLC committee, we've created new trainings for staff, both a foundational training and a refresher training, and for foster parents as well. We've continued to fund the LGBTQ Center, and the Ackerman Institute, who train clinicians to support ACS-involved families, organized and facilitated LGBTQI+ events for ACS staff and provider agency staff, and the LGBTQA+ unit of the Office of Equity Strategies has provided ongoing technical assistance across the agency and our provider community. We also added SOGI questions to our annual Youth Experience Survey, and in the most recent survey, 2024, 35% of the youth surveyed did not identify as heterosexual. We're also in the process of updating our policy, which when completed will be more user-friendly and incorporate a stronger emphasis on the needs of trans and gender non-binary, non-conforming youth in the policy itself. We have sought external stakeholder and youth comments on the policy throughout the drafting process and look forward to releasing the policy for more formal comment in the coming year. Finally, the Office of Equity Strategies teams remains an ongoing resource of support both within ACS and to our stakeholders. In any instance where there is a concern about the treatment of a young person or family, it should be immediately brought to their attention so that it can be appropriately addressed. ACS continues to have LGBTQI plus point people, identified champions at our foster care provider agencies. These point people are empowered and trained to report any complaints or concerns. If there is an incident, providers share a summary, case information, and the staff involved so that ACS can speak with all parties and collaboratively develop a plan to respond. This past summer, our colleagues at the Ali Forney Center approached ACS with their experience, which brought to bear that there were additional efforts that ACS needed to make both internally and with our providers and throughout the child welfare continuum. We are grateful to the Ali Forney Center for the ongoing collaboration and our shared commitment to work together to strengthen. Together this summer, ACS has taken additional steps to address the concerns raised. This includes the ACS Division of Child Protection has identified LGBTQI plus champions and point people from across our borough offices and our Emergency Services Office. The Office of Equity Strategies will be regularly meeting with the point people to provide information on best engagement practices and promote ACS's existing mandatory LGBTQI plus policy and youth engagement trainings. The Office of Equity Strategies is attending DCP zone debriefing meetings to provide information and presentations on best practices of engagement with LGBTQI plus youth. The ACS Division of Child Protection is creating a strategy for centralizing complaints from RHY providers and flagging those complaints so they are reported directly to ACS senior leadership, up to and including myself. The Office of Equity Strategies has reached out to the state to flag the issue of SCR workers dead naming and misgendering youth. The Office of Equity Strategies is currently working with the ACS Division of Prevention Services to discuss how to enhance services for LGBTQIA plus youth and their families. And finally, ACS is also taking steps to strengthen our partnership and relationship with DYCD's RHY providers so that we can collaborate on serving needs of any young person we are partnering to serve. ACS appreciates the City Council's ongoing interest in our work, and we look forward to discussing the three bills from today's hearing in more detail. Intro 5/6/2024 would require ACS to conduct an annual survey of youth in foster care regarding their LGBTQ status and racial identities and their foster care placements. ACS appreciates the Council's interest in this type of information regarding the youth in foster care and look forward to discussing ways to enhance the current annual survey of foster youth required pursuant to Local Law 146 of 2016, which is published annually as the Youth Experience Survey. Intro 8/2024 would require ACS to report on allegation types in child protection reports. This bill would include allegation types that are not specifically included in state law and would not be able to be reported in the manner detailed in the state statute and state database ACS is required to use. Specifically, the state allegation is drug alcohol misuse, and the proposed legislation would require reporting marijuana-related allegations separately, which is not feasible. Notably, the use of marijuana is not an actual allegation of abuse or maltreatment. For any substance misuse, legal or illegal substance, it is the impact of the misuse on the ability to care for the child that could create maltreatment. ACS looks forward to further discussions of this bill with the Council. Intro 81/2024 would require ACS to conduct quarterly audits of foster care placement change notifications. Informing Council when children have placement changes is critically important. ACS looks forward to discussing with the City Council ways to enhance our practice to ensure Council is aware of placement changes. It is of utmost importance that all youth and families we serve are treated and cared for in an affirming manner. We are committed to ongoing training and technical assistance for our staff, provider staff, and foster parents, as well as services and supports for youth and families, so that we can make sure that this is the manner in which all youth who come into contact with us are treated. We look forward to the ongoing partnership with the Ali Forney Center so that we can benefit their expertise in this area, and we look forward to this conversation today. Thank you.
Well, thank you. Thank you for your testimony. I'm going to jump right into it, and I'll just start with last year as the chair of Children and Youth and having ACS added. It was my first year to host Shadow Day here at Chambers. It was amazing. We had a lot of really amazing young people. But one of the things that was like most alarming to me was one of the young people, she came in with a list of legislation. Yeah, she had a list of legislation and was very adamant about her treatment in foster care, and a lot of the treatment was because she identified as LGBTQ youth. And so that sparked my interest in the sense of like, well, what is really happening in these homes? I know we have a lot of questions around some of the policies for staff, but I was more curious about like the side of like, how are we recruiting for these families and what does this look like? So my first round of questions is gonna like kind of focus more on that. Because like I said, it was just kind of alarming with some of the things that she said she experienced, and feeling like there was nowhere for her to turn to get support. There was a whole nother host of other things that they talked about that we'll be having another hearing on. But I just want to say I wanted to just uplift her because the courage for her to come in and not only have legislation, but also was able to kind of talk very freely about that experience. So, and as always, Ali Forney, who I love and partner in this work that I've been doing since I started, that their report also highlighted a lot of this stuff as well. So thank you, Ali Forney, for putting together your report as well. But my first question is, at what stage of the foster care intake process is a young person asked to identify as LGBTQ+, and does the young person have an input on their foster care placement?
So, first of all, thank you, and thank you for uplifting that young person. We too are meeting with young people, hearing from them, understanding their experience, and trying to make it as affirming as possible in all of their experiences and in their full life. We do not ask for that information upon entry into placement. We have determined that the better way to approach understanding the needs of young people is for our staff to get them to know them well, obviously the case planners at provider agencies, coaches now, who I think are an even safer place for young people to have conversations because they're not responsible for things like court and other parts of the foster care system. We also provide them Know Your Rights pamphlets, which include contact information for equity strategies and for Stephen and his office to make sure that young people know there is a place to turn. You need redundancies when you're working with young people. I know I'm talking to someone who works with young people a lot, right? And so we are constantly trying to reinforce the message that they're available, that we are available, that we are listening. So we have activities to bring young people together. Young people are our best recruiters of other young people to get them to the table to understand that there are supports here. We start in the placement process, of course, by looking for family. And so about half of young people who come into our care are going directly to a family member. That doesn't mean that that is necessarily a family member who's fully trained, those family members do get trained before they become fully certified.
And just really
foster
quickly,
parents.
even to think about that, and I know like you guys have made a huge effort to place young people in family care, and that has been really important. But let's say that is the case. Does a young person, would they be able to say like, that's not a good person?
Absolutely.
Okay.
Absolutely. So if they,
What does that look like?
So our child protective specialists are having that conversation with them if they're coming into care as a teenager. So it's a
So only if you're a teenager.
with all young people. So it depends on sort of the young person's developmental stage. We usually engage parents, we engage the young person, we'll engage siblings to really understand who in their life do they trust. So that's the first question if we're moving towards placement. There are child safety conferences where this is discussed. Sometimes someone will step forward right away. Sometimes it'll happen weeks later. But we absolutely make sure young people, if they don't feel safe going to a family member, we're not going to send them there.
Okay. What's the cultural competency training do foster care parents receive to ensure that they're providing any affirming homes for LGBTQ youth? Is there training part of a broader course in foster care parenting, or is there a standalone course focused on best practices for caring for LGBT youth foster care? Also, please be specific whether the training is delivered online, in person, and is it repeated annually? So
every foster parent is trained in our foundational training, and it's repeated twice a year. The foster care agencies are typically delivering that training. We work with Planned Parenthood to update that training and help us to to create the best possible contemporary training for this. I'm going to ask Stephen to talk a little bit about what we did with Planned Parenthood, but every single foster parent has to agree that they're affirming. It doesn't mean that that is something we just assume. We ongoingly assess that and go through the training, and then they do it every 2 years, all staff as well.
And okay. Oh yeah, go. I would like to acknowledge Councilmember Mena, who's also joined us.
Thank you, Commissioner. Also, I want to point out that
You can pull your chair up. You don't have to scooch over. It's okay.
Thank you.
We're a little tight
appreciate
today,
that.
so we family.
Appreciate that. Thank you. So, upon orientation, every single foster parent is to take this LGBTQI plus foster parent training. The staff that provide this training, when they're certified to do that, they're also trained to look for red flags for foster parents that might be unaffirming, they may be seeing trends of homophobia, transphobia, so that they can then alert the foster care agencies leadership to say maybe this foster parent isn't right, maybe this foster parent should not be certified. In that training, the parents learn how to talk to their foster children, no matter what the age, about their sexual orientation, gender identity. They learn to talk about body parts, to talk about gender pronouns, to engage young people about their interests in a gender-neutral way. After that initial training is done, every foster parent also signs what we call an affirming home pledge, which just states that I will accept my LGBTQAI plus foster child for who they are. Foster children in our foster homes are made aware that if there are issues, they can seek out their case planner, and they can also seek out the Office of Equity Strategies as a mechanism of support. If they report that they are...
What's the expectation around them reaching out? What does that look like? Because what if they're in a home where the foster parent doesn't allow them to reach out? What does that look like? Could you just be a little bit more specific about how would they reach out?
So I'll just start with every child in foster care is visited in their home once a month. They also have the majority of them are receiving therapy and other medical services. The youth have a coach. So this outreach to central office is sort of a redundancy, an additional backup plan. So they are first reaching out. They also have an attorney that is assigned to every young person in foster care. So there are a lot of folks who are checking in with young people to see how they're feeling about their current placement, how they're feeling about their schooling, how they're feeling about the services that are provided to them. And so this piece of it that we put in place is just to make sure that if all those fail, there's a backup plan.
Okay. Are you done with the whole thing with the training? Because I know you were talking. Yeah. Okay. Is it done online or in person?
Our foster care agencies are trained to provide the training via either a Zoom or in person, depending on that's at the agency's discretion how they want to provide the training, and really they're going to assess what's better for the foster parents in regards to scheduling, etc.
Every foster home goes through a home study, however, that is in person, that is there's reference checks, there's checks around income security and a full, which we can talk further about, for every young person in care. That is expedited for family members, for kin, but then it happens over the course of the first 90 days while the child's in placement.
Okay. And so is this training, this is annually they have to take this training, or?
Every 2 years.
Every 2 years?
Yes.
Okay. And so if they do have a young person who's in their home who do identify as LGBTQs, they still only have to take it every 2 years?
Yes.
Okay. Has ACS faced challenges identifying foster care homes that affirm LGBT identities?
Not specifically, but we have tried to create a full continuum, right? So we have also have some small residential programs that SCO runs, about 5 of them that are specifically dedicated for young people who identify as LGBTQIA+. We are always looking for, we struggle with foster homes, of course, for teenagers. We have not heard a specific concern about young people who identify as LGBTQIA+, but we are always looking for...
Wait, say that again, I'm sorry.
So
you don't struggle with that, what?
We generally struggle to identify and
In
recruit
general.
foster homes for teenagers. We have been very successful on a few fronts. One is we've been able to reduce the number of children in residential care, not only the number, but the percentage. Even as the entire census in foster care has precipitously dropped, we've also dropped the percentage of young people in residential care. So we're overcoming some of these challenges. We've reduced the number of young people who are AWOC or sort of away from their placement by about half over the last 4 years. So we're trying to surround the placement. The best way to do it is to take an experienced foster parent and surround them with lots of supports and services. So we're not always looking for, sometimes if someone will be a foster parent for a 2-year-old as their first time in foster care, and then they really get the hang of it and feel like I can handle a teenager. I understand the system. So we are always focused on making sure we have homes for youth, homes for large sibling groups. Those are some of the places. Homes for young people who are medically challenged. Specifically around youth who identify as LGBTQ, we have not seen a specific need that we haven't been able to meet.
Well, I would beg to differ because when you go to the homeless runaway youth facilities, a lot of them are there, and a lot of them come from the system. And I think it also stresses me out when we say things like we've reduced the numbers, because that means we still have young people. So yes, that's good, hooray for doing our jobs, but we also can't forget that there's still young people there. So yes, we should be reducing the numbers, right? And so I just always get really weary, like, yes, we're doing our job, great. But we still gotta make sure that we're supporting these young people, because we know it's hard, especially for teenagers. But again, when you look at which is why DYCD is here, right? And made sure they were here because a lot of those young people end up in their drop-in centers and in their shelters because they're leaving these homes because they're not getting the care and affirmations that they need. And so, I mean, I guess you said you don't, but you guys have never thought about doing specific recruitment for LGBTQ youth foster parents, especially if we know this is a population who needs, additional affirmations and affirm sometimes?
Absolutely, we have.
And what does that look like?
Yep.
Well, first, let's just be clear. Just because you're LGBTQ doesn't mean that you're appropriate to be a foster parent.
Oh, absolutely. Oh, don't get me started. That's not what I'm saying.
And so, but also, we recognize that we want to diversify our foster parent pool. In 2021, the Office of Equity Strategies worked with our permanency division. We took a group of foster care agencies, made a work group to plan how they could better recruit from the LGBTQI plus community. From that work group, we were able to provide those agencies with best practice for recruitment, thinking outside the box outreach, equity checklists to ensure that their promotion is gender neutral and inclusive. And we also were able to support them in hosting a couple of recruitment fairs via Zoom during peak pandemic times. And it's to our knowledge that they're still practicing what we learned during that work group.
Okay. Yeah, because I also want to make sure that we're being inclusive of when we're recruiting, because people also want to feel like they're part of things. And so we should make special efforts to make sure that we're recruiting in all communities, because we just want good people.
Yeah.
And I want to make sure that we're also recruiting in that community as well, because they make great parents as well.
Absolutely.
Are foster parents or families informed of a foster youth if they identify as LGBTQ youth, and do your current policy allow for them to decline a placement?
So if the young person has shared that with the case planner or the child protective specialist, it absolutely would be shared with the foster parent. So there are many times when they have not, that's not something that they feel comfortable disclosing yet or having the conversation about. We will certainly, if someone declines a placement, we will allow them to decline that placement, because we don't want to put a child into a place that they're not going to be affirmed. But you cannot be a foster parent in New York City unless you're affirming, and so we move to assess that home and often to close that home if that ends up being the case.
So if you decline a young person because of whatever, you're like, okay, so you're done?
Specifically related to that status. If they are declining it, we ask the agencies to do an assessment, because our expectation, they've pledged that they are going to be an affirming home. This is something that Commissioner Carrion put into place in 2015, I believe, that all foster parents were expected to be affirming, and so we follow that policy. It's often not entirely clear if they decline a placement, right? It could be they are concerned about a particular behavior. So I'm not saying that, they will say I'm declining it because of a young person's gender expression, but we want to be very careful. Agencies are responsible for ongoing assessments of all of their foster homes.
No, absolutely. I think that's what's the most important.
Yeah.
All right. I have a couple more questions, and I'll pass it over to you, Farrah, because I'm fading. What specific intervention strategies or discipline measures are in place to address inappropriate behavior by foster parents, and how they are and how those procedures monitor to ensure accountability and the safety of foster children?
Thank you. This is where the LGBTQIA plus point people and champions in each of the provider agencies play a really, really important role. And let's have Stephen to talk about that.
So in regards to foster parents, if it has been made aware that the foster parent is being inappropriate with the young person around their SOGI, a young person has every right to ask for another placement. We try to empower the young people to alert the caseworker or the attorney that they've been assigned, and we, with the hopes that they will alert our leadership in our permanency division and my office. At that point, we would step in to provide counsel to the foster care agency to figure out whether or not the young person should be placed elsewhere. And if the young person is facing homophobia and transphobia, then they absolutely need to be placed elsewhere. And if it's evident that the foster parent is homophobic or transphobic or just discriminatory, then we alert the foster care agency that they need to essentially fire the foster parent.
There's also, if it raises to a level where the child's being neglected and having mental impairment is the sort of state standard, or emotional impairment, our Office of Special Investigations would get involved as well and do an investigation of the foster home.
Okay. According to ACS 2021 LGBTQ Action Plan, the agency's plan to increase its therapeutic services for foster care parents/kinship caregivers by expanding access to family therapy through the Eichmann's Institute. Was this program ever implemented?
It was. Both Ackerman and the LGBT Center are funded by us to train clinicians to specifically work with this population.
Okay. And how's that partnership going?
Well,
it's been going well. I think it's roughly about 8 years old. We support both Ackerman and the center in recruiting the clinicians for the program. The clinicians have to work within the ACS continuum of families. We're finding that clinicians specifically, are gaining knowledge and engagement of families, supporting families through the affirmation process, and really looking at how language can support young people when engaging with families who might be homophobic or transphobic or really struggling to get to a place of affirmation for their child.
In response to monitoring complaints over the treatment for LGBTQ plus in foster care system, the Ali Forney Center and ACS announced a new agreement to prevent abuse and implement new policies aimed at providing safe and affirming home environment for LGBTQ plus young people. Can you share some of the top line points of this agreement?
Sure, and we really are grateful to Ali Forney, as I mentioned in my testimony, for bringing this to us and for partnering with us to continue to improve our practice. One of the main areas of focus for Ali Forney and what they were seeing in the RHY providers was the work of our child protective teams and making sure that they were being as affirming as we are expecting everyone in our system to be. And so we have taken some of the successes from other parts of our system and begun to implement them in child protection. All child protective staff already have been provided the foundational training and do the training every 2 years. But specifically, we're adding champions point people in each of our borough offices We are going to convene them, much like we do with the foster care agencies, and promote best practices through that. They both many advocates, and we're going to engage Ali Forney and the RHY providers in making sure our updated policies are sufficiently strong. We're working on trainings together. We're also convening with all of the RHY providers in October to have a robust conversation between our child protective teams and all the RHY providers. We've also...
And when is that? You said in June?
October.
October? It's this October?
Yeah.
Oh, maybe I'll come. Tell me more.
Fantastic.
October 16th. I'm writing it down. So
Good. I think it's in the morning. Yeah.
10 a.m.
10 a.m.
Yeah, I know I love to pop out.
We'll have virtual options for you, in-presence option,
a
however you
virtual
want to do that.
Great.
I do also want to mention that one of the key things that was pointed out there was that young people were being dead named, intentionally or unintentionally. I think mostly unintentionally. When a call happens, let's say an RHY provider calls the SCR and says a young person just showed up, their parents are transphobic, and the child's being neglected. When the SCR records their name, they often use their legal name. And so then our staff would go out using that legal name, which creates a lot of trauma for a young person, right? And so we are reworking that whole system, working with OCFS to see if they can make sure they're asking the questions of the RHY provider around what is the preferred name that the young person has, what are their preferred pronouns. We're also retraining our staff, even if that is not there. When you're doing this, we need to be going out and asking that question before we call that child by any name other than what they want to be called.
Okay. I think that's all the questions I have for right now. I'm going to pass it over to Councilmember Lewis, and I have some questions for DYCD, but I'll do that after she.
Thank you, Chair Stevens. Good afternoon again.
Good afternoon, Chair.
Some quick questions for ACS. Foster care and juvenile justice placement provider agencies are required to designate an LGBTQ plus point person. This role is responsible for maintaining records of all LGBTQ plus related issues that arise within their agencies, including reports of harassment, bias, and any unmet needs for affirming foster home or juvenile justice placement. Can you confirm that there are LGBTQ plus point persons appointed to fill this role, and if so, how many?
Yes, we have 26 foster care agencies, and I believe we have 37 point people, because some agencies, 34, some agencies are spread out geographically by different programs, and so they have more than one.
Can you name those agencies?
I can name a lot of them. They're all the foster care agencies. I don't want to say who's the top three.
Fine.
Children's Aid, SCO, Grand Wyndham, New York Foundling.
SCO we're familiar with, right?
Yeah.
Good. Are foster youth informed that LGBTQ plus point persons exist? I think you highlighted that in the previous questions that the Chair Stevens stated.
Yes.
And how are they able to report issues of harassment and bias to these point persons?
So through their any way they want to report it, through their case planner, through their coach, if they have a therapist, through their attorney, and we are educating all of those parties to reach out to us as well, both to the point person, and the point people can reach out to Stephen and his team.
In 2023, how many claims of bias and discrimination related to foster youth placement were recorded by the LGBT point person at ACS?
So for our central office, it was 5. I'll let Stephen talk a little bit about that. We know there's other issues that have been resolved at a lower level and did not need to come there, so I don't want to inaccurately say that we think that's the full universe, but 5 where we got deeply involved.
Thanks, Commissioner. Yeah, the 5 that were reported, we worked with the foster care agency and the young person to resolve the issue. We interviewed the young person to ensure that they still felt safe in their placement and with the agency, and we made it essentially a corrective action plan with the agency. We are seeing more and more of professionals in foster care agencies be proactive to reach out to us if they're struggling with a case plan, trying to figure out a young person's housing plan or a young person's mental health medical plan, that our office also provides technical assistance around.
And would you say that's the same amount that was stated? Was it the same amount that requested to be removed from placement due to those claims?
We had no young people in 2023 that asked to be removed from their placement because of bias or discrimination based on their SOG.
Thanks.
Sure.
Can the agency please detail what is included in the mandatory LGBTQ plus cultural competency training ACS staff are required to complete before hire? If you could please specify whether the training is online, in person, and is this training taken annually?
Sure. Thank you for that question. Training is really critically important to the agency, our large workforce. Our training is required to be taken every 2 years by direct service staff, their supervisors, our provider agency direct service staff, and their supervisors as well. The foundational training that you referenced, Chair, really references or outlines our LGBTQ youth and care policy that talks about engagement, pronouns, chosen names, how to safety plan, best practices for creating affirming and safe environments. We have a refresher training that's taken after the 2 years after the initial training that really builds upon that knowledge of how do you build an appropriate case plan, how do you engage a young person around transitioning, how do you help young people find outside supports and communities.
Okay. Is ACS considering providing additional guidance for staff on how to identify homophobia, transphobia in foster homes? What methods of intervention are being explored to ensure that these inappropriate behaviors are being addressed and corrected?
For us, and as Chair Stevens opened with, it's really about implementation. We are revising our policy, but it's around having these redundant systems that continue to communicate out to young people that they can share with us, share with someone that they trust. The addition of coaches for young people and them all being trained in this as well. So what we're really think is sort of the foundational basis of this is that the young person is somebody that they trust and that they can have these conversations with. So we are constantly working to build that and bring more resources to bear to young people. And so we expect that our agencies, they really understand young people. There are times when young people are first coming into foster care or have had an experience in foster care where that trust wanes. And it's our job to make sure that they have any avenue that they want to take to connect with us and to get the support that they need.
Okay. This is a quick question on the Unity Project. The Unity Project is tasked with working across agencies to address issues facing the LGBTQ community in New York City. One of its 3 core focus areas includes addressing acceptance and anti-discrimination. Can you share with us what the Unity Project has been doing in terms of supporting LGBTQ foster youth?
Yeah. So
If you could turn on your...
Thank you, and thank you for that question. So this is a very important issue here in New York City, across the nation, and it's one that I often think about, whether personally, professionally, is how to encourage this sort of acceptance, particularly for LGBTQ plus youth. And so starting out in the beginning of the administration, the mayor hosted a number of different roundtables, and coming from those roundtables was a focus on LGBTQ plus youth and encouraging this sort of acceptance. And so we were happy to begin developing with the Department of Health and Mental Hygiene the Unity Project Family Acceptance Program. This program runs through CAMBA, and it focuses on a multi-pronged approach to ensure that LGBTQ plus youth are able to find and live with affirming caregivers. And so that multi-pronged approach includes various multimedia that really encourages and allows people to see how being an affirming family makes an incredible difference in the lives of LGBTQ plus youth, and how different people go through different phases of acceptance and what that means for their youth. The program, in addition to this multimedia component, in addition to the social media, includes education. And so that is education on sexual orientation, gender identity, gender expression, and gender. And then it also includes a number of different resources. There is a wonderful reading list that is included as part of it, and other materials on basic vocabulary that really get families and caregivers up to speed and understand basic LGBTQ plus cultural competency and the overall importance of creating this sort of affirming environment, not just up until 18, but how that has lifelong impacts for LGBTQ plus people. And then the last point that I will finish off on regarding the program is that there is a component of therapy, whether that is group and peer therapy or one-on-one counseling for families.
Chair Stevens has a quick question based off your response.
I just because the Unity Project, honestly, I did not learn about what you guys did until we were preparing for this hearing. So I just have a little bit of questions around clarity. And so are you like working with are you working with providers? Are you more of a go-between between like, ACS and like DYCD? I'm just trying to get a better understanding of what this is.
Yeah, that is a great question, and I often get that question. So Unity Project is the LGBTQ plus programs division at the Mayor's Office of Equity and Racial Justice. The way that it works is developing and funding various innovative programs and initiatives across city agencies. So I mentioned DOHMH. We have also worked with ACS on various programs. That is one part of the work. There is obviously a significant amount of community engagement. So to your second point, yes, there definitely is significant go-between between the community and the different levels of government to make sure that services are being rendered and that they're culturally competent services.
Okay.
Just piggybacking off of that question, has the Unity Project worked with ACS, DYCD when it comes to their respective policies regarding LGBTQ youth?
Yes, so being a programs division, I'll touch upon ACS first. ACS mentioned some of the programs that we have worked on them with, but that includes the training of the licensed social workers, clinicians through Ackerman and the Center. That was originally funded in partnership with the Unity Project and then fortunately baselined through ACS, and that's really an effort to create this sort of ecosystem across the mental health and social services sector to support LGBTQ plus youth and to further that sort of education and creating that sort of affirming environment. So that's one particular way that we collaborate. I frequently check in with Stephen, and Stephen was actually the first person that I met in city government in this role. And so we have been continuous thought partners throughout this entire process. We also partner on public engagement. And then Stephen is well aware of the Family Acceptance Program and has the information on that to share within his respective network. Canva has also reached out to Stephen at ACS, and so it's important that we have that sort of integration with this program, and that program in particular is well placed to serve a lot of the needs related to ACS. And then with regards to DYCD, there is constant collaboration. There's a number of different programs that I can touch upon in the past. Unity Project has worked with DYCD to fund the expansion of 3 youth drop-in centers to 24/7 service, allowing an expansion to an additional 400 young people. Another program that's 400 young people and then service across all 5 boroughs, 24 hours a day. And then the other program that I could touch upon is Summer Youth Employment Pride. We finished our second cycle, and that is run with DYCD. We see significant challenges for LGBTQ plus youth, particularly in educational contexts and then employment, and that I think is compounded given some of the challenges that we see today in youth experiencing and facing homelessness and family rejection. And so creating a sort of opportunity for them to lift themselves up, for them to be acclimated to the workplace, for them to be able to have various experiences and learn in that sort of manner, I think has been really important. And we do that not only with our agency partners, but also with our community partners, such as the Ali Farnay Center, and they've been absolutely instrumental in that sort of programming and really connecting their youth to that programming. And as I mentioned, really ameliorating any sort of challenges that come up, whether it's challenges with documentation, whether it's challenges with recruiting youth. And so fostering that sort of connection between the agencies and the government and then the nonprofit sector.
Thank you for that. I have two more questions, and I hand it back to Chair Stevens. When Chair Stevens asked you a question, you had mentioned roundtables. So the Unity Project was created under the former administration, under de Blasio, now under the Adams administration. How many roundtables have you been hosting under this new administration?
So during this administration, there has been 3 roundtables in total. 2 that's the first one was the LGBTQ plus roundtable at the start of the administration. The second was the TGNCMB People of Color roundtable, and then recently there was an LGBTQ plus roundtable. That is one forum for this sort of community engagement. This engagement is ongoing. Additionally, there was recently a roundtable in August related to TGNCMB safety matters. So that is an opportunity to bring together different CBO partners, but engagement of that sort happens whether it's in a roundtable or some other format, check-in with various community-based organizations, not only at roundtables and not only during Pride, but really year-round. There's often times where I meet with the Ali Farnay Center every single week and sometimes more than once a week, and so those are ongoing discussions. Roundtable, I think, is one source where people are able to share that sort of information and have that sort of thought partnership across the administration. But it's certainly something that is important so that we're not just working in some sort of silo here.
Thank you. I have a quick legislative question. The pre-considered introduction on today's calendar would expand the Foster Youth Experience surveys that ACS distributes to include specific questions about the treatment of foster youth related to their gender expression, gender identity, sex characteristics, and sexual orientation. If passed, how does ACS plan to use the feedback to drive policy change regarding the LGBT plus foster youth placements?
We're very interested in speaking to the council further about this, and we have this annual survey. It's a really important source of information for us, both on the representation of young people, LGBTQI plus young people in our system, their satisfaction with our system. We take all of that survey result and not only produce a report, but we reflect on it. We reflect on it with our providers. We build strategies off of it. Many of the ones that we talked about today came from that. We'll also digest it with our Youth Leadership Committee, including the subcommittee for LGBTQI plus young people, to really help understand with them, sort of understand what are ways we can get better at this area, how can we build on this area of strength. So we'll want to have that conversation with young people to make sure we're getting it right.
All right, thank you. I'll yield back to Chair Stevens.
I just have a couple questions with UICD, so I think we need to make a little room.
Amy's here.
Okay. Oh, okay, great.
Assistant Commissioner for Runaway and Homeless Youth.
Okay, great. All right, so given that LGBTQ plus youth aging out of foster care system is this disproportionate with their placements often enter the homeless and runaway youth system, how does the DYCD coordinate with the ACS to address the unique needs of those young people, and what specific supports are in place to ensure access to essential services?
If a youth ages out of ACS care and ends up in our system after, I guess, their discharge options failed, is what I'm hearing. How do we work with them? Okay. But we try to connect them back to ACS. ACS has a unit that's specifically designated for older youth that have aged out of the system. So if they're still eligible to come back into the system, our first option is to connect them to that unit to make sure that they could explore all of the options that's available to them through foster care.
Could I add, Chair, that we do not discharge young people to homelessness. There are, and we've been reducing the number of young people aging out of care, and we're focused on them, as you were saying earlier. So we've been increasing housing options. So young people who age out of care at 21, most of them actually stay past their 21st birthday as we're working on housing options, whether that's city FEPS or Section 8, some of the emergency housing vouchers, or NYCHA or supportive housing. There is a group of young people, less than half of the young people who quote unquote age out, who sign themselves out of care at 18, 19, and they might be going to a family that they think is appropriate. If that disrupts and they end up in the RHY system, that is possible. That is where they can come back into foster care and they remain eligible for all of the housing supports. So if that disrupts before 21, those are young. We're trying to reduce young people who leave us at 18, 19 to unstable on their own volition, and it's coming down, but that's a population I worry about all the time, and so that's why we allow them back into care. But I think that's some of the population that we see at RHY.
Yeah, I mean, that's a population that I'm always really worried about as well, because those are the ones that we kind of see cycling out of the foster care system into the DHS system, and it becomes like a perpetual cycle. And so I know that there's things put in place, but sometimes I don't know if we're catching all the ones that we should be catching. I think some of my colleagues, I think he left already. What anti-discriminatory policies and training does DYCD have in place to ensure that runaway and homeless youth shelters are inclusive and affirming in LGBTQ youth? Additionally, how does DYCD monitor and ensure that the shelter providers remain compliant with those policies and agency and guidelines?
The providers are required to complete training annually. Every person who works for one of the provider organizations is required to complete LGBTQ sensitivity training to understand LGBTQ issues. So in our audits, in our reviews of the programs, we go out and we check to make sure that every staff member has competency in that area.
How does DYCD gather feedback from LGBT youth that are experienced within their programs if it's funded? And how often is feedback used to drive policy and programmatic change?
So if a youth within the DYCD system has a complaint, there's a complaint process that they can follow that would allow them to speak directly.
Can you talk a little bit about what that process looks like?
It requires them to call 311, and then through 311, they're connected to our unit, and we would follow up with that youth directly, personally, to hear the story and try to, resolve the issue that they may have had with their provider.
I didn't know that it required them to call 311. How do you get that information out to the young people to have that?
In all of the programs, whether it's residential programs or drop-in centers, there are flyers that are required to be posted in conspicuous areas that has the information to how to reach out to us if they have a complaint. And every time one of our program managers make a site visit, they're required to check and make sure that that poster is posted in a conspicuous area. It's part of their evaluation process.
Yeah. We ever thought about having that part of the intake process to give that information out?
Actually, we recently, maybe about 6 months ago, required that flyer be included in the handbooks that are handed out to youth when they enter into the programs. So it's part of their intake packet, information that they take away from the intake.
Does DYCD track data relating to a number of homeless and runaway youth that are aging out of foster care and transitioning into DYCD? And if yes, if the information aggregated, how many of those young people identify as LGBTQ youth? As
Commissioner Danhauser just said, we do not have youth that discharge from ACS to DYCD. That's
Yeah,
not
I mean,
a thing.
it's kind of our question because they don't necessarily discharge, but we know that they sometimes bounce back and forth between the systems. And so, do you guys track that information? And are you tracking to see like any who might be LGBTQ youth or?
So upon intake, we do have the question of their child welfare involvement is a required question on all intakes, as well as questions about their sexual orientation and gender identity. So this is information that we have available to us that we're able to track.
And so if a young person does show up at, let's say, at one of the RHY facilities, and they are saying they come from ACS and not being discharged, but they are like running away or whatever, what does that look like? What does that process look like?
I think that if they ran away, because it's situational, we would try to connect them back to their foster care agency. The foster care agency still has planning responsibility for them to see if they can get back into a foster care bed if they're run away and they're still in foster care. But if it's a situation where that person has, let's say, aged out of foster care system, went into their own apartment, something went wrong with that, then we would reach out to the older age unit to get them reconnected to the foster care resources that are still available to them, if they are still available.
Okay. In 2023, how many of the homeless young adults between 21 and 24 served in DYCD identify as LGBTQ youth? Do you have that information?
Roughly 35%.
35%. I believe Councilman Williams have questions.
Hello. I'm going to ask questions that Councilmember Riley had. On his bill. Hello, Commissioner.
Councilmember.
I think it's this one. Okay. The audit would include a review of instances in which a notice was not provided as required, the time elapsed between a change in foster care placement and when the placement notice was provided, when notice of the change was provided, the attorney for the child, and a summary of the information that was missing from the notice. So the question is there any compliance concerns about the foster care audit bill?
Anytime there's a bill around data or auditing, it's a capacity issue, and we have to find make sure we have the bandwidth to do it. But Councilmember Riley's focus here is really important. We want to first of all, reduce the number of young people who are experiencing a movement in care. Most importantly, that has come down in the latest MMR, and so we're making progress in that regard. It's also really important that their attorney, that anybody in their life knows that they have moved foster homes. And so the focus here is one that we very much welcome. The mechanism that we use to oversee it and make sure it's happening is one we'd like to be in discussion about.
Thank you. How has ACS ensured that caseworkers are sharing information regarding notice of change in foster care placement with the child's attorney? What barriers has ACS been facing that has prevented this information from being shared with attorneys?
So our Family Court Legal Services team oversees this process. So agencies will communicate with the FCLS attorney, who will share that with the child's attorney, will share it with the parent's attorney. There are, sometimes challenges in communication, but we speak to the providers regularly to make sure that they're communicating with everybody and that they're communicating in ways that are timely. We think by and large we are meeting the mark here because we've got lots of redundancies put in place. So each agency is required to put this in the system to make sure that the right foster parent is getting paid, that they have QI systems in place, and that they're flagging it immediately to the FCLS attorney. We also have in place conferences that come together when there's a potential for a move. Say a young person suggests that they want to move, or a foster parent needs help. We try with placement preservation conferences. We try to come together and say what services could happen here. Is there services we could do together, foster parent and young person or parent, and see if there's a way to preserve that. If it's not able to preserve and the child's moved, now we're doing a more planful move, and we're able to. So the more often we're doing those planning conferences and doing a plan for move, the easier it is to make sure we're communicating around it. When it happens on an emergency basis, which is more rare but happens, that's where we sometimes see some breakdowns in communication. But we really want to make sure that their attorneys know and are working hard to do it.
Okay, and can you just help me understand the internal operations of foster care in general? So I know like a lot of the foster care services happen to be carried out by providers. And so in terms of like actual government ACS workers, what is the feedback loop between ACS and the providers? Because the providers are really doing like the day-to-day work, and I'm just trying to understand internally, like what is the feedback loop if something does happen in an emergency, or an agency needs to take a particular action. I know they're not like calling it ACS to say, hey, can I take this action? I think they're probably like taking action, but just wanted to know like the feedback loop back to the agency and the child.
Yeah, and we would love to set up some time with you, Councilmember, to talk through that. Deputy Commissioner Mendez and her team have an office that we call shared response, so it's shared with the agency. Any emergency situation, any major decision that they have to make, that's available to them, and it is well utilized. We also have circumstantial, so if a child's going to move or there's a decision around adoption or reunification, there are conferences that are convened. Our staff will, most of those conferences, some of the conferences are facilitated by providers. We also have a robust oversight looking at every agency's data around how often children move in their care, how often children are going home safely, how often they're contacting children. We do case record reviews of all agencies. That gets rounded up into a score for the providers, and we meet in a process that we call continuous quality improvement, where agencies identify their areas of greatest strength and areas of greatest weakness with us, and we develop plans to resolve those. So we know every agency how they're doing on what we call permanency, which is sort of combined. Are they getting children to a loving home, hopefully home, or to a kinship provider or adoption in a timely way, and a variety of other areas around safety, how many of their children have left their care, et cetera, et cetera, et cetera. So we can walk you through all that and how we work with them to try to continuously improve.
I have more, I have lots of questions about that. Like I want to understand like cadence, like how often you're having these continuous care conversations. Okay. And then just two more things somewhat on the hearing topic, but it could be more expansive. Does ACS have like credible messengers within ACS? Because the former foster care young person that Chair Stevens mentioned, one of the things she also noted was like wanting to be able to support other youth who identify as LGBTQIA, and I just was wondering, like, do you have like individuals who have gone through the system that might identify, that can sort of support young people who are currently in the system? And then the last thing she had mentioned that I thought was quite interesting was the clothing budget. So for instance, you may present as a woman, but maybe you want to wear men clothes, and your foster parent is telling you no, you have to go buy dresses. And so she talked about like this sort of back and forth issue with clothes and the clothing budget. And so just wanted to know like what stipulations or support can they have to say, like, especially if they're older, like, I don't want to buy that. Can I buy something else? And for them to be able to buy the types of clothes that, or again, if they present as a male and they want to wear a dress, like, how can we ensure that the things that they want to wear, that they're actually allowed to pay for and wear those things through the budget?
Thank you. And if this young person's looking for a job, I'd love to meet with them.
I want to hire her too.
This is really, really important to Deputy Commissioner Mendez, that young people get what they want, that they have an individualized experience that's tailored to their needs, what their interests are. So not only is there an initial clothing allowance, there's also in the rate sort of ongoing clothing allowance. Young people are allowed to purchase what they want to wear. That's also sort of part of many of the trainings that we're doing for foster parents, including the LGBTQIA+ trainings. We also are looking at some of the ways in which young people get stipended. We have college choice, and we make sure that young people can access that kind of resource. I think as far as credible messengers, we have both formal positions in the providers and at ACS. We have the Youth Leadership Committee, there's the Youth Advisory Board at Fair Futures, but there's a lot of staff at ACS who are credible messengers, but aren't in roles that are specifically to that. So if you come to the Children's Center, there's a lot of our staff who have had lived experience, who have been in foster care. We obviously also care deeply about lived experience for parents, and so have staff that are in our advocacy office that have experience in that way. And it's deeply, deeply important that they're seen and that young people and families know that they're in our system. Each agency has parent advocates. Many of them have youth advocates. We've really, really been lucky to have a wonderful YLC and the Youth Advisory Board. So we're trying to find every way to hear from young people.
Thank you, and I'll follow up about foster care.
Great. Thank you.
Councilman.
I should have said the one thing about DC, sorry, Chair, just there's also a special payment mechanism. So if the clothing allowance, I lost my train of thought there, isn't sufficient, or they've decided that they're going through a transition, there are special payments that providers can make and charge back to ACS for those.
Oh, Commissioner, if I will.
Yeah.
Also, I do want to say our Youth Leadership Council is made up of both current foster care youth and former foster care youth, and it really is a mechanism of creating community, as well as the chairs of our Youth Leadership Council are 3 ACS staff who also have lived experience. And in regards to the clothing allowance, if a foster parent is not allowing a young person to wear the clothing that corresponds with their gender, that is an example of a non-affirming parent, and ACS and the foster care agency would then step in and intercede.
Thank you. Councilmember Joseph.
Thank you for that, and thank you for keeping the practices. My 2 boys came from foster care, so anyone ever heard of my story? So my 2 boys came from foster care, and you know that, and I fight really hard for them. I had a couple of questions around the allowance. Is there ever going to be an increase to that allowance? Because parents can't really, if you really think about it, it's not ideal. Is there any way that formula can be raised?
So yes, it has been raised, and we can get you the exact numbers because the state raised the rates about 2 years ago for all foster parents. They did not cover any of the costs of that, just as a asterisk. So
inflation.
The city has picked that up and is making sure that foster parents have adequate rates. We are also looking at ways in which we provide stipends to young people. Often they've been attached to an independent living workshop or something like that.
Or school.
We're trying to attach them to things that encourage young people along the way of their success. We're doing $60 a day in college choice is one example, and so we're in a planning process right now around what those stipends might look like. But the allowances have been raised, and we can get you those numbers.
That would be great. How's the partnership with New York City Public Schools foster care office with our students now in foster care?
Yeah, we've been really grateful to have that partnership. We just had a meeting looking at graduation rates together, attendance rates together. The MMR is showing increases in attendance rates. We still have a ways to go, especially for teens in foster care. And so we want to, that office has been great, as we have talked about and you have advocated so strongly for, around transportation and making sure foster parents are reimbursed. We have a new policy in place, much to your advocacy. So they've been a really great source of connection and information. And, it's out of 900,000+ students in the system, less than 7,000 are children in foster care. So we're also working with them to re-up training for all local, all schools to make sure that they're identifying young people in foster care that are there and that they're getting everything that they're entitled to. And lastly, I will say it's all of the work that we've been doing in New York City public schools around accessing help outside of the foster care system for families has been something that's been a real boost. The office has really boosted along with Donna and her team.
Because we know when students enter foster care and they enter the New York City public schools, it takes about 30 days for them to get to school. And we want to reduce that chronic absenteeism rate. Yep. As students are entering care, we want to make sure that's also reduced. And the amount of bullying our students, because I visited a school who's transgender students in foster care, how do you work in making sure safety transfers are done appropriately and rapid?
So we have a dedicated education team in our agency that is under our family permanency division, and they get flagged to them. They work with either local school or through the office. On the matter of transportation to school, I also just want to uplift the work of First Deputy Commissioner Saunders and her team at the Children's Center, and adding every transportation option you could possibly imagine to make sure every young person is getting up, getting to school, getting to their original school, because we know in that moment, losing your school in addition to losing the placement in your family can be really traumatic. And so school stability is a major focus of ours. So whether they're at the Children's Center, whether they're going to Staten Island or they're going to the Bronx, they are an amazing team who's up very early in the morning making sure young people are getting out the door and we have the right transportation options for them.
That's very important. In our, how many students LGBTQ plus do we currently have in our foster care system?
Our estimates is around 35% as well, and that comes from our survey, and that's been pretty consistent in our time surveying young people.
Okay, thank you. Thank you, Chair.
Thank you. I just have a few more questions on some of the legislation that we heard today. Intro 8 would amend existing reporting requirements regarding the child welfare system by requiring ACS to additionally report the main allegations that led to its receipt of a report of an opening case of investigation of child abuse or neglect. The allegations would specifically include parents or caretakers' marijuana usage and inadequate food, clothing, and shelter. Is the agency supportive of this bill?
We're supportive of the intent. There's difficulties. The state law drives what gets tracked as an allegation, and so substance use is not an allegation. It's really around sort of the whether or not any substance is impairing a parent's ability to care safely for the child. So marijuana is not an allegation, as an example. And so someone calls the state central registry and says this parent is using marijuana, that they're not going to accept that. And so what we want to do when we talk to the deputy speaker and understand sort of the intent, we want to make sure we are not, as a system, that we are consistently looking at whether the substance misuse is affecting parenting. Yeah. And if that is the intent of there, to find ways to be able to always have accountability there and make sure we're promoting best practice.
Yeah, because that was the next part of the question, just around like, especially because marijuana has been legalized, like what have you done to like update your policies? What does that look like? Because I do know like with the registry, it's a lot different, and you actually have to have to know, so it's a little different. But just like, have you updated those policies, and what does that look like?
We've trained staff. We also have made sure that we're communicating through ChildStat, through all of our conversations with staff and training, that it is about the impact on the child. As you know, we've been reducing the number of instances where we're filing neglect petitions or abuse petitions in family court. And one of the areas that we looked at sort of many years ago is how do we make sure that we're not just using a positive toxicology. A lot of the work has also been with health and hospitals. They are putting in place plans of safe care. So if they're making sure that they're asking for consent from parents to do drug testing at the time of birth. And if a parent is found to be positive tox for a particular substance, they too have to ask the question, is this likely to impair the parenting? And are they seeing evidence during that time? If it's not, then they put in a plan of safe care. They can connect families to services, and they do not call the SCR. We've seen a drop in that, and it's critical that those plans of safe care are strong, and we know Health and Hospitals is working on that.
Okay, well, I look forward to hearing more about that. I'm
Great.
sure Deputy Speaker as well. The next one is Intro 56 will require ACS to survey foster youth as their LGBTQ and racial identities and report annually on such responses as they relate to placement of foster youth into permanent homes. Does the agency foresee any complications with collecting this data?
No, we are currently surveying. We added SOGI questions last year to 2021, and so. The one thing I will say is whenever we're surveying, we want to have some questions that are consistent so we can see progress or lack thereof. But we're open to having dialogue about what questions best answer what the council's interested in.
The pre-considered introduction would expand the foster care youth experience surveys that ACS would distribute to include specific questions about the treatment of foster youth related to their gender expression, gender identity, sexual characteristics, and sexual orientation. If passed, how does ACS plan to use this feedback to drive policy changes regarding LGBTQ youth, foster youth placements? And how will ACS ensure that foster youth completing the experience survey are comfortable expressing any grievances toward the agency? Are there currently any other options for response to their anonymity and completed without the ACS worker present?
I'm going to ask Stephen to ask about the anonymity question. We will take every single survey completed is a young person's voice, and we take it very seriously. As I was mentioning earlier, I really want to digest those results with our committee of young people and understand what they see as strategies that would work for them. And we each time we finish the survey results and analyze them, we put out our plan of action for that. And so we'll continuously update that plan. On the anonymity piece for the survey?
The survey, I believe, and Ina, correct me, it's confidential, not anonymous. So then we could aggregate that data, right?
Yes.
Okay. You want to add to that? Yeah, we got to swear you in though, man. Yeah.
I see. So we want to be able to follow up with the young person, and so we asked them to include their identity. Yeah, I got there. If there's something that needs immediate follow-up, whether some of the issues we were discussing earlier, if there needs to be a placement change or if they feel like they're in danger. They also do have, as we were mentioning earlier, lots of options of places to go, whether it's their attorney, whether it's their coach. So we're just trying to increase options and the trust with them.
Okay. I think that's all I got. Does anybody else have a question? No? Okay. No questions? All right, well, thank you guys for being here with me today.
Feel better.
I'm trying. I appreciate it. I made it. Thank you guys. I really appreciate it. All right. I'm going to take a break. I go to the bathroom. A 2-minute break.
Okay. Yeah, Long Island. Linda knows. We border Long Island. Yeah, we do. Elmont is the 3 minute walk from me. 0.0 minute drive. I'm literally on the border. I'm on the border of Elmont and Rose Floral Park. Yeah. Oh, south. You, what's your border? Because like I'm close to your border. Yeah. That's on the border of King Philip. That's Belrose. Yeah, Belrose, Floral Park, Elmont, Valley Street. Those are my Long Island borders. Okay. And it's right there. It's like it's closer to get to Long Island. I'm not going anywhere. I'm just thinking this blanket that I purchased. Hello. On JetBlue. They robbed me. It was freezing on that.
I did not rob her.
No, I said
I was gonna say.
JetBlue robbed
She
me.
like left
No,
mad stuff in the
JetBlue
car.
robbed me.
We got out. He was like,
$15
he's like, "Yes, I was
for a
still in the car."
blanket.
She had left her
Freezing
blanket.
on the plane.
She left
I was
a
like,
jacket.
okay, I don't care how
She
much
left a
this is.
sweater. Oh, when was this? This is when we went to California. Yeah. Mad stuff in the car. I was like,
I did leave a lot of stuff.
it was so much stuff.
No, I don't know. It was overpacked. It was just stuff I had.
You just had like everywhere because you had it in your hand. It was a jacket, a sweater, a blanket. I was like, what? I was like, is she naked?
Hi, Sarah. How are you?
Oh, wait, but I gotta read now.
Oh
I
yeah.
gotta tell people to behave.
Yeah. And then here's.
Does Farrah, can't Farrah help me with these damn lists?
You're leaving? Or I'm leaving right behind you.
I don't see why not. I think technically you're supposed to because we're leading. But I mean, who's gonna say anything?
No, I'm saying, I was just saying, I hate doing these stupid, I hate this new process. It's dumb.
I agree. I wish I
So
could
wait,
just do
I
it.
call all these people up at once?
No, for the first panel, this second panel.
Why do you have so many on the second panel?
It's only 3. Because there's only 3 chairs up here. Sorry? 5 in person, 2 online.
I love a little Korean Chinese mix.
I'm ready. I'm back. Hi. Yeah, I don't. Hold on.
Can we all have a seat?
I did 3 and 2.
I made a mistake.
I'm doing 3 and 2. And not 2 and 3 because you did 3. Because I didn't like it. I changed it. I get to decide.
Trust me, Mom.
I do trust you, but I don't understand why we had 2 and 2. All right. I now open the hearing for public test. Oh, wait. Are we ready? Oh, sorry. I now open the hearing for public testimony. I would remind the members of the public that this is a government proceeding and decorum shall be observed at all times. As such, members of the public shall remain silent at all times. Everyone here behaves well. The witness table is reserved for people who are wishing to testify. No video recordings or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but they can submit transcripts of such recordings to the Sergeant of Arms, which the Sergeant of Arms for inclusion in their hearing record. If you wish to speak today, please fill out an appearance card with the Sergeant of Arms and wait to be recognized. When you're recognized, you will have 2 minutes to speak today on the hearing topic addressing the needs of LGBTQ plus youth in the city child welfare system. If you have written testimony or additional written testimony you wish to submit for the record, please provide a copy of the testimony to the Sergeant at Arms. And now I would like to call to the table. Oh. I'm sorry, I'm having brain fog. Aaron Harris. Nadia. And G. Gwalway. Oh, I'm sorry. I don't do this name thing well, and I'm sorry. I'm terrible at it. I have some literacy issues.
Yeah, I hear that. Sometimes things just have unnecessary.
Whoever would like to speak first.
Hi, good afternoon. Thank you so much to the committees for holding this hearing today. My name is Erin Beth Harris. I use she or they pronouns, and I'm the director of the Legal Aid Society's LGBTQ+ unit. And I work with our juvenile rights practice, which represents the majority of kids in foster care in New York City, to address systemic issues impacting our LGBTQ+ youth clients. I will say, we appreciate that ACS comes to the table. I appreciate their action plan, but we know from day-to-day work that it isn't enough and that there needs to be more done. Just to give a couple of examples, and we've talked about these already today, we know that a lot of our LGBTQ+ youth clients do not feel safe to be themselves in their placements. And sometimes they're overtly discriminated against through misnaming and misgendering, not being able to express their gender the way that is natural to who they are. We've had trans clients housed in facilities that are not consistent with their gender identity, and we've had a lot of issues with access to transition-related care. Just a couple months ago, we heard about a young person who was told their transition-related care was considered cosmetic, and therefore that it wasn't something that was going to be provided by the agency. And that's wrong as a matter of policy. That's wrong as a matter of law. We've also had clients where the discrimination is a little less overt, but this involves clinicians who will hear that somebody has, same-sex attraction and consider them to have issues with boundaries with their peers, and they end up in more restrictive housing because of it, right? So we know that the clinicians, we also need more accountability and training there as well. And I also want to emphasize, because this is something that comes up quite a bit, has already been referred to a lot during this hearing, LGBTQ youth leave their placements more frequently than other youth. They experience homelessness as a result. And what does it say about the system that they feel safer being homeless or being marginally housed than they do in their placements? Just briefly, we put all our recommendations into our
10 seconds
into our testimony. I did want to raise the issue of ACS taking dollars in survivors benefits from ACS youth. This wasn't raised today, but it does impact youth in foster care, and that ACS needs to change this policy immediately.
Don't worry, we'll be discussing it at other hearings. I got it.
That's great. Thank you so much.
Hello, everyone. My name is Nadia Swanson. I use they, them pronouns. I'm the Director of Advocacy and Technical Assistance at the Ali Fernay Center. Thank you for having this hearing today. Thank you for sticking around, ACS. And a big thank you to Commissioner Dan Hauser and Stephen Gordon for really coming together and supporting us when we brought these recommendations to you and acting swiftly. My testimony today, I'm going to focus on Intro 56, but our written will go into more detail in the other areas. One thing is just an amendment where we suggest that the age be lowered from 13 years old to 5, that we start tracking this data and starting to talk to the foster youth about this. The Trevor Project, among many other research findings, shows that youth are self-identifying or coming out at a younger age, even if they don't have the language yet. This is a dynamic process that often begins early in development. The survey was for 13 to 24-year-olds and showed a sample of 24% of folks coming out before the age of 13. And when we just looked at 13 and 17-year-olds, it jumped to 35%. Those folks who came out under 13 also shared that 56% of them had seriously considered suicide, and 22% had attempted. The report confirms what we know, that family support greatly diminishes these risks. For trans and gender expansive minors, we know that developmentally at ages 3 and 4, we begin to understand gender in a societal context, developing over the next 2 years and becoming rigid at around 5 years old. Studies show that 5 is actually the average age that a young person knows that they have gender variance in some way, with the mean being 7.9. They just might not have the words to say it. I actually previously worked at the Ackerman Institute Gender Family Project that we were talking about today and went through that clinical training. I was in the first class of that. And the work that they do at Ackerman starts at 5 years old because of this data. We suggest that this lower, and we can provide different developmental questions and different stages throughout the person's process, the child's process. By identifying early signs, we can prevent further trauma of child hiding their identity of fear, providing the parents training and therapy for early childhood, which really benefits the kids from the constrained social construct, and ultimately reducing the need for more placements in the future if we can get that training in faster. Thank you, and happy to answer any questions you have.
Good afternoon, Chair Stevens, and thank you, Councilmember Williams and Lewis, for being here today and holding today's hearing. My name is Galloway. I'm the Advocacy Manager at the Ally Forney Center and want to echo the things shared today by Nadia and Aaron. Today I want to speak to the support of Intro 2477, particularly regarding the proposed youth experience survey. At the Ally Forney Center, we understand firsthand how crucial it is to understand the LGBTQ plus young people having a voice in the space of their experiences and being able to openly share that. A survey provides an opportunity for them to share their grievances with transparency and accountability. However, the success of a survey hinges on the thoughtful development of that. And when a young person comes to us who has involvement with the child care system, the foster care system, particularly, they share with us their experiences they've had with ACS workers not being affirming. And we see this far too often when those workers are not affirming their youth's gender and sexual identities. At AFC, we are hearing these stories after an intake of an 18 and 19-year-old who has voluntarily left the system due to homophobia and transphobia they've experienced by not feeling heard and not being taken the actions to protect themselves by those workers. What these youth are describing is a form of abuse, and the least we can do is give them multiple ways to speak to their experience. There are numerous considerations when creating a survey on sexual orientation and gender identity. Terminology needs to be carefully chosen to ensure that these participants fully understand it, and we consider the inclusion of multiple options, things like making sure there's an option to write in and that they get to choose how they speak about their identity. These are essential in capturing the diverse ways in which youth experience and speak about their experiences. We also believe that the survey, to be successful, must be developed by youth themselves and practitioners with experience in running inclusive, accessible surveys. This will ensure that the survey captures data and also relevant to their experiences. Lastly, just want to thank ACS for working alongside us in collaboration and sticking around today for today's hearing. Feel better, Chair Stevens. Beaming you healing support. Thank you.
You have a question? I just have one quick question, because you had mentioned the clinicians, and sometimes they're also a part of some of the issues with, like, talking about boundaries with young people. Could you talk a little bit more about that? And then also, is there any recommendations around, like, what are some things you think we can do to put in place to kind of safeguard that as well?
Thank you so much for that question. I think it really comes down to accountability. If you look at the policy, one, it's outdated. Best practices for working with gender expansive people have changed since 2012, and the policy has taken a very long time to change. But there's also not a lot of accountability provisions for if a clinician is behaving in this way. And I think those need to be added into the next draft of the policy, which my eyes on the last draft policy, which was over a year ago, that was not in there. So that's something that I would greatly recommend that changes.
Yeah, no, I just think it's important because sometimes we do miss those pieces that, like, a clinician is part of this process, and they can do some harm if they're not trained properly or if things are not put in place. So I would definitely love to talk more about that with you offline. And also, survivor benefits, it is very important. I am on it. We're going to be having, not a whole hearing on, but on foster care, and we'll be spending a lot of time talking about survivor benefits stuff. So I don't want to throw a curveball at them today since they were so well behaved. I try to be nice to ACS. I don't want to throw them a curveball. But thank you. There's no further questions. Thank you. The next panel, we're going to have Pedro Gonzalez and Luna Floyd. Oh, bye. See you later. I'll see you later. I'll call you later. You guys can start whenever you have a chance.
Good afternoon. My name is Luna Floyd. I'm a legal fellow at Lambda Legal Defense and Education Fund. And we would like to show our support for the Council's consideration of Councilmember Osei's bill number 56 and Council Members Hudson's bill marked 2477. Council Members Hudson's proposed bill could be improved by adding questions about whether foster parents, caseworkers, or other adults know about a young person's LGBT identity. The option for anonymity allows youth who are not out to ACS or other adults to be more accurately counted. If youth have not disclosed their identity to adults around them, the survey should then ask youth to identify reasons for that decision. Additionally, we want to emphasize that a survey can only be the first part of the work needed to make ACS a safer place for LGBTQ youth. ACS must also finalize and implement a plan to ask youth in care about their gender identity and sexual orientation directly in a respectful and culturally informed way. Finally, we also want to recommend that Councilmember Osei's bill include language requiring ACS to involve youth in the development and analysis of these surveys. ACS's Youth Leadership Council must assist in drafting surveys, analyzing results, and developing policy and practice change proposals based on that data collected, because youth are experts in their own experiences and must have a say in decisions that affect them. We would also like to recommend that the City Council require ACS to report on its past and current efforts around data collection. We urge the City Council to pass these bills and commit to making sure that this is just the first step to improve experiences and outcomes of LGBTQ youth in care. And thank you for your time and attention.
Good afternoon to everyone in this committee. Ms. Camones, she will be speaking. We both filled out the paper, but I'm sitting with her just in case. She'd like to share some personal testimony. I know today's focus is on gender and protections for LGBTQIA, but previously we've brought up a concern about reporting and being transparent with respect to ACS data, but I'm going to turn it over so she can share personal experiences quickly.
Could you just state your name for the record again, please?
Pedro Gonzalez and Tabitha Camones.
Good afternoon to the councilwoman, councilmen, and overseers of the Committee on Children and Youth for the City Council. My name is Tabitha Camones. I am a 36-year-old mother of 4 children and also an American with mental health and intellectual disabilities and physical health conditions, such as diabetes type 2, grand mal seizures, absence seizures, they are also known as phantom seizures, and a right bundle branch block, which is a hole in the heart, for those that may not know. I am a mother of 4, 1 stillborn son and 3 daughters, one who was adopted at 8, She is now 8, and 2 children who are in care, ages 5 and 4. My 5-year-old daughter was born with intellectual and some disabling, physical disabilities. I've had to endure with ACS for 8 years, even though my oldest is adopted. I still get lashback because of my prior addiction. I am a recovering addict as well. The ACS target me with my mental health and addiction. Of course, addiction, is not always good in cases like that. I have had disparaging remarks about past substance abuse and having NYPD directed to arrest me during certain removals. I've had homemaking in my home and preventive services since 2021 of October, and they were still removed as well with all of that in place. I feel like I'm running in circles and I have nowhere else to go. I would like, if at all, somebody to be able to please help us with this, because every time a removal, my daughters are asking if it's their fault, and we cannot discuss the case with them because of the rules of the case. I'm sorry if I rambled. I do get nervous, and thank you for taking your time to hear me.
You did fine. Thank you for being here today. Mr. Pedro, do you have?
Very quickly. So I've been around previously on April 25th. I shared briefly my experiences with the case about ACS. So one of the things that I wanted to mention very briefly is that oftentimes when data is being generated by ACS, it's not being transparent, presented to this administration, or rather this body of council. It's very concerning because I've stated previously that, and I'm glad Mr. Danhauser was able to somewhat go over the figures, but there was an increase this year by 1%, especially in low-income communities. Oftentimes, the problems with low-income communities, and especially those who are at risk, that also includes people with military special needs families and LGBTQI members. Housing is the biggest concern. ACS often tells us that is a hurdle to coordinate efforts with other city agencies. I think that this body could do with a measure by implementing a liaison that would be assigned by this committee to oversee those concerns of housing and or other ailments that would disenfranchise families. First and foremost, we all know that working on one income isn't sufficient. Ms. Kimonis herself is a recipient of survivor's benefits from her father, who was a World War II veteran, as well as myself, who served in the military. We see the value that ACS has tried to improve the system. We recognize it takes a village to care for the children, but oftentimes not everyone agrees on the best interest of what is important for the children. We feel that parents should also have a proactive role in that, whether it be in the question of gender affirmation, whether it be in the question of reunification, what do those processes look like. Parents should be given all the information and tools at their disposal so that they are able to make the best informed decision for themselves and to support their children. We firmly believe that also this would play a beneficial role for children impacted in the LGBTQIA. As a veteran, I have seen hostile culture towards LGBTQIA members, and I feel personally that this committee could do with addressing these people who are being disenfranchised. I thank this committee again for taking the time to hear what Ms. Kimonis and myself had to state. And again, we do appreciate the wonderful work that this administration and currently this body of council is doing. You guys have been proficient with making sure that ACS is being transparent and that they are at their best trying to report everything transparently and proficiently. Thank you and good afternoon again.
I just want to say thank you to both of you guys for being here today. I really appreciate it. I do remember you from testifying at the last hearing last year, and I know that we took your information, and we still want to be supportive and help as much as we can on anything that you guys need. I know ACS is here. They're also here, and I'm sure you'll be able to speak to them as well, but we want to make sure that we continue to give you the support that you need and point you in the right direction.
One more thing I'd like to add, after we spoke to Mr. Danhauser, we did let him know that I think it's about time that ACS from the top up should be reforming. As a person who's trained in the military, I believe that leadership is vital in holding their personnel accountable. Oftentimes, I don't want to make accusations that the agency may be double dipping or committing some sort of fraudulent activity with respect to the Department of Social Services and federal funds and state funds that are being administered and utilized. Oftentimes when the family asks for that support, ACS is oftentimes dissuading the family or ourselves in this case when we ask for assistance. It's one hurdle after the other, whether it's for benefits for SNAP through HRA or whether it's through OCFS and the Department of Social Services. There needs to be some sort of easy, streamlined communication between the state and city in order to best implement the assistance needed for families, especially those who live in vulnerable housing that could be considered subpar. So again, thank you guys.
Listen, I 100% agree with you, and I think that's some of the things that we are always trying to figure out, how to create less bureaucracy and how to make things easier and getting the services to the people who need it most. But unfortunately, the government often is about bureaucracy, but I'm all about figuring it out because I say it all the time. I don't like things that don't make sense, and some stuff just don't make sense.
And to be honest with you, I think appointing a liaison to oversee military special needs families and for people with LGBTQAI would be very beneficial. That it should be that this body appoints somebody that would be experts and not just having child care professionals, but actually the parents involved in the process as well, so that the parents can give their feedback and input based on their personal experiences. For whether we all like it or not, our personal experiences shape our development and who we are and what roads we lead in life. And I want that opportunity to be presented for my children when I fought tooth and nail to get to where I'm at today. Again, thank you guys so much, and we don't want to take up any more of your time. But if you have any questions or anything, you have our information. You can feel free to reach out to us.
Thank you. And thank you for your service. And I know even in City Council, we did just do an initiative with veteran services coming out of all of our districts. So definitely we'll be in touch so you can have that information as well, because we are trying to make sure that we are giving more support to our veterans and people who serve our country. So thank you guys for being here today.
Thank you guys again.
Thank you. We will now transition to the remote testimony. I would like to call Regal Noel.
Starting time.
I would like to call Elizabeth Ward.
Starting time.
Good afternoon, and thank you for the opportunity to speak with you today. My name is Elizabeth Sirocco. I'm the Integrated Treatment Model Director at the Children's Village and the co-chair for the agency's LGBTQ plus staff affinity group. The Children's Village serves over 20,000